Welcome to the Inside Connection podcast powered by MediConnect. I'm your host today, Lance O'Brien. Great to be back with you and great to have Mark Clark, one of our managers, works with our agents, helping develop them on the podcast with us for the first time. So, Mark, why don't you say hello and just kind of tell everybody why you love doing this like we do?
Oh, I love doing this because I love working with people. I've always loved helping people. Gives me a great opportunity to affect people's lives because health insurance or health coverage is a big part of our lives. And, the older we get, the more we're going to face those challenges with our health. And nobody wants to pay a lot of bills. Hey, if you save money, you want to use it for vacations and golf and treating your grandkids and all that fun stuff. So,
Speaking of grandkids, you have a new one, don't you?
I do, yeah.
That's why you threw that in, isn't it?
Yeah, it's the first one. Her name's Kira. Yep, born a couple weeks ago. Yeah.
That's awesome. Congratulations.
Yeah, we're happy.
Well, if you're tuning in today and you're not really sure who we are, MediConnect is the top-rated advisory firm in the state of Pennsylvania. We really focus on education, helping people understand how Medicare works. We simplify not only the information, right, Mark, but we simplify the process, right?
That's right. Yeah.
Should they go to Medicare? Should they not, right? Should they stay with group coverage? How do they choose private insurance? And as we've been walking through this podcast, so far this year, we've really been talking about different aspects. We went over original Medicare, Parts A and B, which you're super familiar with, Medicare Advantage, enrollment time frames, a lot of stuff. And today, we're going to jump into Medicare supplements in just a few minutes. But again, all of the advice, all of the meetings we have with people, there's never a cost for our services, which is great, and super helpful for people. So, Mark, let's start here as we talk about Medicare supplements today, right? Yeah. We really want to dive into this type of private insurance.
Right.
Why do people, because I think we need to answer this question first before we even talk about Medicare Advantage or supplement. Why do people need private insurance with Medicare?
Well, the reality is there's extra cost that comes with just having original Medicare Parts A and Part B. There's other costs, out-of-pocket costs, and there's no max out-of-pocket. So, when you're talking about Part A, you're talking about deductibles, you're talking about extra money for inpatient hospital coverage if you go beyond 60 consecutive days in the hospital. That can add up really quick. There's no cap on that.
Right.
And then Part B really becomes, after you pay your monthly premium, it becomes, and the deductible becomes an 80-20 co-insurance, right? And so that 20%, you're on the hook for that 20%.
Yeah, and I think you hit on the big point, right? There's no maximum out of pocket.
Yeah.
Right?
Yeah.
Maximum out of pocket, if you're not really familiar with the term when it comes to insurance, that's essentially your parachute, right? Like if you're going to jump out of a plane, you want to have a parachute.
Oh, yeah.
And with original Medicare Part A and B, you don't have a parachute.
No.
It's amazing to me how many people over the years I've run into that have said, well, I just thought Medicare covers it all. Right. And if you have a long hospital stay on Part A, no private insurance to back it up. And when I say a long hospital stay, I'm talking about 150 days consecutive. So that's a long stay, right?
Sure.
And again, in the normal course of events, we wouldn't think that would happen very regularly. But we've seen it just in the last few years.
Yeah.
There was a lot of people in the hospital for long periods of time.
Right.
That hospital stay, without any private insurance, $60,000 and some change.
And I don't know about you, but I don't have that just laying around waiting to pay a bill.
No, and especially if I've worked all my life and I'm now into retirement, right?
Yeah.
I certainly don't want to take 60 grand and throw it on something that I could have gotten for $250 for one stay, or I could have gotten for nothing, right? So that's where like this information is so valuable. So no max out of pocket, big risk. So as we start jumping into this, what's the number one thing people need to know about a Medicare Advantage plan? Because I think it's important to say this, and then the number one thing they need to know about a supplement to kind of set the stage.
Yeah, Medicare Advantage plan replaces original Medicare.
What does that mean?
What that means is you're not subject to the deductible and the extra money for inpatient hospital coverage, and that 20% in most cases only for a couple things. When you're on a Medicare Advantage plan, it becomes your Medicare. And so that product, whatever carrier you're with, that Advantage plan shows you a summary of benefits, shows you line for line what you'll pay for particular services or things that you need.
Yeah, and I think a good visual for that, for people that may be trying to listen in today, watching today, to try to figure it out, is if you go with an Advantage plan and you go to the doctor, you don't show them your red, white, and blue card and your Advantage plan.
That's a great way to look at
You
it.
don't go to your pharmacy and show them the red, white, and blue card and the Advantage plan. That red, white, and blue card can go right in the safe.
Yep.
Right, and then you just show them the Advantage card, and it becomes, as you said, your health coverage, your
Yep.
Medicare card, essentially. So
Yeah.
if that's the number one thing people need to know about a Medicare Advantage plan,
Yeah.
what's the number one thing they need to know about a supplement? What's the overarching principle?
The supplement works with your original Medicare. So what happens when you're on a supplement plan is original Medicare Part A and B, that's your primary insurance. That's what's going to bill first, right? And then the supplement, depending on what you have, which plan you buy, it's going to come in afterwards. And this is why they call them Medigap plans,
Yep.
right? Because it comes in and fills in the gaps of what A and B did not pay for. It's either going to pay for all of what A and B didn't pay for, or it's going to pay for almost all, which means you just have a little bit to pay on your own.
Yeah, and that visual holds true. Now, if you go with a Medigap, right, you're
Right.
going to show them the red, white, and blue card at the doctor's office,
Yep.
at the hospital, right, and then you're going to show the Medigap card as well, right?
Correct.
So Medicare Advantage, the Medigap card. Now, it's going to be a little different with how you handle prescriptions and all of that, which we'll get into in a few minutes. But Medigap plans, as you said, what they actually do, you already kind of jumped into the first one. They cover what A and B doesn't cover, right?
Right.
Now, do they cover it all?
Yes, yeah, you pay your monthly premium. There's a deductible. The ones that are popular today and available today, there's the deductible $226 this year is what the
Okay.
deductible is. That gets adjusted from year to year. But once you pay if you're paying your monthly premium, you meet your deductible, there's nothing else out of your pocket, depending on the plan you purchase.
Right, yeah, so we'll get into naming conventions a little bit later. People, again, that are watching may have heard of Plan N's. Maybe their parents had Plan F's, because
Maybe.
back in the day,
Yep.
those used to be super popular.
Yep.
Right, but depending on the letter plan you get, that actually goes into the amount of what's covered of A and B. So
Correct.
that's one of the principles, or what these plans actually are, is they're offered by private insurance companies to fill the gaps,
Yeah.
right,
Yeah.
of coverage of A and B. Now, also Medigap plans, they're standardized by the federal government.
Yeah.
What does that mean?
What that means is, it doesn't matter what company you go with, what carrier you go with. It means that every Plan G is the same. It has to have the same coverage. It has to offer you the same benefits. A Plan G 10 years ago is still the same as a Plan G today, and still is the same as a Plan G in 10 years. What's different from carrier to carrier would be what they're going to charge for it.
Okay, so kind of picking up on that is basically, you mentioned how they're offered by private insurance companies,
Yep.
right?
Yep.
But they're standardized by the federal government.
Correct.
So everyone has to offer the same thing,
Yep.
right?
Yep.
But there are going to be some different nuances in the customer service,
Yep.
the pricing of the companies. So here locally, and again, there's a lot of companies nationwide
Yep.
that actually offer these plans. But locally, who would be some of the common companies that would offer this?
Sure. Highmark, Aetna, United Healthcare, Humana, Cigna, right? Big companies out there that can offer great coverage. Again, each different letter designation for those. Those are standardized by Medicare, and so they have to offer the same type of benefits, the same benefit package, and there can be some nuances to some of those customer service issues, right?
Yeah, so why would somebody say, so if a Plan G is a Plan G,
Right?
no matter whose name is on the card. I mean, when
Yep.
I first started back in the business, I had someone tell me, as long as it's a government standardized plan, it could say Mickey Mouse Clubhouse on the card, right?
Right.
Now I don't know if he's in the business of offering supplements or not, but literally what the name on the card doesn't necessarily matter to the benefits provided,
Right.
but how can it affect the service and the price?
Sure. Well, the service, some of these plans can offer some little extra bonuses, maybe 10% discount card here or there, some things like silver sneakers, stuff like that. But the service you're going to get and the coverage you're going to get is the same with the Plan G for whatever carrier, right?
Okay.
And so, and so I always put it like this for people when we're talking about shopping for a supplement plan, right? If I was to go in the area and go to every BMW dealership in the area and I was looking at a specific BMW and I wanted certain interior, exterior, different light packages, sports package, all that stuff, right?
Talking my language.
Yeah.
Let's go.
So like if I was to go to all of the dealers and they all had the same exact car, and I was going to buy one of those cars, which one would I end up getting? I mean, for me, I'd be getting the one that cost the least, that had the lowest price tag. If it's the same product, every dealer's a little bit different or whatever, but the truth is I'm buying the one that costs the least.
Yeah. And I think something that's really important to note here is company X or Y isn't the lowest everywhere. It is truly dictated by zip code.
It is, yes. It's a very good point.
And the reason for that is all health insurance, all life insurance, car insurance, mortgage insurance.
Yeah.
If it's insurance, it's always tied to a zip code because there's risk factors around that.
There's risk factors in this region that you don't have in other regions.
Yeah, so if you talk to somebody else who has a supplement and they say, well, you should go with this carrier because they were the best price.
Right.
Well, just because they were the best price for you doesn't necessarily they might be the best price for the person in that zip code. So there is a shopping element to it where we really have to make sure that if they decide in going to their private insurance, I want a Medigap and not an Advantage plan, then it's figuring out what company based on the customer service and the pricing makes the most sense.
Sure. And the other thing we think about and look at a lot of times is how stable are those companies? We want to write with companies that are very, very stable so that the price isn't going to get jacked up.
Absolutely, because the prices do. And so we're about at the end of this first segment. We're going to come back in a few minutes. We're going to talk about the pros and the cons of Medigaps and then who would be best suited for a Medigap as their choice for insurance. But if you have questions today, 888-818-6334. You could also go to mediconnectinsurance.com and you can fill out a ticket there to have to be contacted by one of the advisors. Mark, we're going to be back just in a minute and we'll keep diving deep here.
Yeah, let's do it.
Medicare is confusing and a little scary.
Plan B, Part B,
HMO, PPO. I feel lost.
Whether you're just starting Medicare or currently on Medicare, you're faced with critical decisions each year. Questions like, do I need a Medicare plan? Is my current coverage still my best option? Will I still be able to see my doctors? I'm Brian Breisinger with MediConnect, the area's premier independent healthcare advisory firm. We can help avoid costly pitfalls today and in the future. We can meet with you in person or over the phone. Choose an expert in your community.
MediConnect walked us through everything.
Best of all, it didn't cost us anything.
That's right. Our licensed experts can offer unbiased advice on all of your healthcare options at no cost to you.
MediConnect is a great organization.
MediConnect, bridging the healthcare gap. For no-cost advice, call 888-818-MEDI or go to mediconnectinsurance.com.
Welcome back to the Inside Connection podcast powered by MediConnect. I'm Lance O'Brien, joined again by Mark Clark. And Mark, in the opening segment, we were talking about Medicare supplements and essentially how this type of insurance works in the marketplace.
Right.
So as we come back into it in this segment, we really want to break down the pros, why people like these plans, the cons, what they're not so favorable about, and then who's best suited for this type of plan. But before we do that, I think it's really important that you give that overarching principle again of a Medigap, because that's going to play into what we talk about.
And it's really simple. You have original Medicare, that's parts A and B, and if you get on a Medigap supplement plan, it works with A and B.
Okay.
A and B is your primary insurance, and then your Medigap supplement plan comes in afterwards, and pays for all of what A and B didn't pay for, or pays for almost all.
Okay, so now let's jump into, so you actually hit one of the points is, what are the things people really like about these plans?
Sure.
Is it eliminates a lot of the out-of-pocket costs for inpatient and outpatient services.
Yep.
The way I like to say it is, if you go with a Medigap, a medical emergency is never going to be a financial emergency, right?
Yeah, that's right. If you pay your premium, right? Depending on the plan you get, you pay your premium, you have that once a year deductible, then there's little to no out-of-pocket costs. So again, we walk into homes all the time. People only have A and B. Maybe they have a drug coverage plan. And my first question is, have you been in the hospital?
Right.
And usually I hear, yes, I was in the hospital 2 years ago. And I say, did you have a bill? Yes, I'm still paying on that bill, because there are extra expenses. If you only have A and B, you're going to be subject to extra money coming out of your pocket, and there are answers for that, right?
And I think that's actually a really good way of putting that, because A and B, for most people, if they're not using their coverage, they're like, this is great, right? I'm not paying much for it. Maybe they go see the doctor, they might have a small copay,
Right.
et cetera, right?
Right.
But it's when the hospitalization hits, right?
That's it.
It's when significant Part B, and I think a great example here would be, if all you have is original Medicare and you have, unfortunately, a cancer diagnosis with chemo,
Right.
I mean, we could be talking tens of thousands of dollars, if not more.
Right. Yeah. Those Part B drugs, you're subject to 20% of what that's going to cost.
Yeah.
Right.
So
And
the supplement basically comes in and covers that 20%.
absolutely. The supplement comes in and takes care of that for you, helps you pay for those. And, again, you pay your premium, you have a deductible, and in most cases with a supplement, you're going to have very little out-of-pocket cost. And it just depends on the one you choose.
Yeah, and it's not like the deductibles most people are used to on their group plans, where it's not a $2,000 or $3,000 deductible.
A couple $100.
It's a couple $100,
Yeah,
and then
yeah.
everything's covered. So people really like that about the supplements.
Sure. Yeah.
Second thing they really like about the supplements is, because Medicare is still primary,
Yeah.
what kind of network access does that give them?
Nationwide.
What does that mean?
That means you can go to any hospital, doctor, or provider that will take original Medicare. If they take original Medicare, they're going to take your supplement plan as well. That's just how it works.
So if I'm an RVer,
Yeah.
and I live in Pennsylvania, I got my Medicare card and my Medigap,
Right.
and I'm going through the middle of Idaho, and
Yep.
I get out of my RV and I got a flat and I try to fix it, and I get stung or I get bitten by a snake, and I
Yeah.
got to go to the nearest hospital.
Yikes.
I don't know where that came from. We're just rolling with it now.
Right.
I can go to a provider in the middle of Idaho,
Idaho, Iowa, California, Texas, Florida, you name it.
and it's going to be just like I'm here.
Just like you're here. Yep,
As long as
national
they take
provider.
Medicare.
As long as they take Medicare. I really haven't found a hospital yet. I always jokingly say, I imagine that somewhere in California near Hollywood there might be a hospital that does plastic surgery that might not take it.
Yeah, because I don't think that's Medicare covered, right?
Probably, yeah.
I could use a little bit of it, though. I'll have to get it done before then. So one of the other things that I think is important to point out is, because it works with original Medicare,
Right,
if Medicare covers it,
right.
the supplement's going to cover it.
Yeah.
So what about prior approval? Is that really a problem if you go with a supplement?
With a supplement, you don't have to worry about prior approval. You just have to understand and know that if Medicare is going to cover it, it's going to be covered by your supplement.
So you don't have to jump through the hoops of managed care.
Nope.
Which you could see some of that on the Medicare Advantage side. You can see that in the group side, right?
Yeah, you know who's in charge of your medical coverage or your decisions? You and your doctor. Your doctor says, hey, I want you to go get an MRI. Guess what you do, Lance? You go get an MRI.
Yeah.
Right? And so, you have more control over those things and those choices.
Yeah, and again, I think that's really important to know, because, again, everybody that's listening today, and you and I know this, is when we get older, we need more medical help, right?
Yeah.
And being able to get it quickly, being able to go anywhere, knowing we're not going to spend a lot of money out of pocket, all of those things are really important. That's why people do like these plans. And the other thing I think that's important to mention as to why they like them is, and we did mention this in the first segment, is these are standardized by the federal government. It's a
Yeah.
contract, right?
Yeah, yeah.
So they don't have to worry about their Plan G changing all of a sudden 2 years from now, 3 years from now. Now the premium's going to go up,
Yeah.
right? But
Yeah.
they don't have to worry about their coverage. So that's really a lot of the positives. Let's jump into the negatives.
Sure.
Okay, so it covers A and B,
Yes.
the out of pocket of A and B. And I know when I'm talking to someone, I always am like really stressing that, and they probably don't know why. It covers the out of pocket of A and B.
Right.
That means that there's some things it doesn't cover. What
There.
doesn't it cover, Mark?
Number one, it doesn't cover prescription drugs. It has no prescription drug coverage built into it. So you have to buy a separate prescription drug, a standalone, we'll call it, prescription drug plan that will help cover with Medicare, you're required to purchase a prescription drug coverage plan, even if you're not on prescription drugs right now. They want you to have that coverage. Now, you can choose not to, but then later on, whenever you would go to get that prescription drug coverage, then you could be subject to a penalty because you didn't get it when you were supposed to.
Right. And if I'm reading between the lines for the people that are watching today, listening, that means if I have to get a standalone prescription drug plan because it's not covered by my supplement, that means there's another premium.
There's another premium. Yeah.
Right.
Yeah. And there's another deductible in most cases. And that deductible can be quite high, and actually, depending on the tier or level of drug you're on, you could have to pay that deductible just straight up front the first time you go. And that can be a significant cost of upwards of $500.
So there's more upfront out-of-pocket cost
Yes.
if you tend to go this direction.
Yep. There's some upfront cost. And then if we go further with other things that the supplement's not going to cover, we're going to talk about things like dental, vision, and hearing, right? Dental, vision, and hearing. The only dental, vision, and hearing you get on original Medicare is what's medically necessary.
Yeah.
They don't really care whether you need maintenance so you can see, or whether you can chew your food, or whether you can hear your wife say, "Honey, there's a spider in the other room," right?
Right. So medically necessary, probably a good example of this is somebody's a diabetic.
Yeah.
Right.
Yeah.
And usually diabetics need to get glaucoma screenings.
Correct.
That
Right.
glaucoma screening is going to be covered because their medical condition necessitates it.
Correct.
Right.
Yep.
But they're not going to cover their eyeglasses.
Right.
They're not going to cover their routine dental exam, the
Nope.
x-rays.
The
So
cleaning,
if they
none of that.
want that, they're either going to have to self-pay
Right.
or get another policy.
Have another policy. And you mentioned it earlier that a good way to show the difference is, right, with the Advantage plan, you have that red, white, and blue card, and you have the card that's your membership to the Advantage plan. You can put that red, white, and blue card away, and that Advantage plan card is good at the doctor's office, at the pharmacy, at the dentist, at the hospital, right? But with the supplement plan, remember, A and B is your primary insurance. You've got that card. You got to have that card with you. You're going to have to show it. Then you have a card for your supplement. And then if you need to pick up some prescriptions, you're going to have a card for that. And then if you need or want to have coverage for dental, vision, and hearing, you're going to have at least one more card that helps you cover those things. So your wallet's getting filled up with cards, not necessarily cash.
It's getting filled up with cards and you're losing cash. And again,
Right.
that doesn't mean it's bad because
No.
the coverage is great. And that's, to me, as long as I've been doing this, everybody who's ever heard me talk about this knows this way I feel. Medicare Advantage is not right. Supplement is not wrong. Supplement is not right. Medicare Advantage is not right. Wrong.
Right.
It depends on the needs of the person.
Yeah.
But if you go the supplement route, there are going to be multiple premiums and ultimately higher premiums. We do need to talk about underwriting real quick as time's kind of passing.
Yeah.
If you go with a Medicare Advantage plan, you never have to go through underwriting.
Not ever.
Not true with a supplement though, right?
No, not true with a supplement. When you first come onto Medicare in your initial enrollment period, you get like a golden ticket.
Okay.
Medicare closes its eyes and says, hey, look, you choose what you want. Have a supplement, have an Advantage plan. You decide what you want. And so you get this free pass, let's say, to choose
Willy
what you
Wonka's
want.
golden ticket.
There you go. Yeah, you get the Willy Wonka ticket. You get the entry and you get to choose what you want. But if you decide not to go on a supplement from the beginning and then let's say a year or two later you decide, I'm on an Advantage plan, but I want to go to that supplement. I'm going to try you're going to face what's called underwriting questions, and that's simply about 25 to 30 questions you're answering while I'm helping you with the application. I have to ask those questions. Here's the thing about it, Lance. It's either a yes or no answer.
Right.
If you answer yes to one of those questions, it's out. They're not gonna approve that application.
Yeah, and it's really based on your health. I've had people in their 80s
Yeah.
that have qualified,
Yeah,
right? I've
yeah.
had people in their late 60s who haven't been able to.
That's
It's
right.
not a physical, it's a series of questions. So Mark, as we're wrapping up, time seems to go so fast.
Yeah.
Here's a few people that the supplements would really be good for. When somebody has significant chronic conditions,
Yeah.
when they go onto Medicare, right? And they may not be able to pass underwriting later,
Yeah.
the supplement might be a good choice for them.
Right.
When they travel a lot,
Right.
right? Because of that nationwide network, they can have flexibility there. Those who desire predictive costs, meaning I want to just pay my premiums and know I'm not going to spend a whole lot more.
Right.
And, where strong Medicare Advantage plans don't exist.
Yes.
And
Yep.
this is a big thing, isn't it?
Sure, it's a big thing. I mean, we live in an area where there are really strong Advantage plans and that are available, very competitive market. But you can go to other areas of the country and those Advantage plans aren't as strong. There might only be one or two in the market. And so you don't have a lot of choices there. So a Medigap plan in that case is a good choice.
Yeah, so I mean, here locally, 35% of people will go with a supplement, 65% with an Advantage plan. You go a few hours south,
Yeah.
you got 80% of people taking a supplement. Location really matters, and that's one of the things we really help with is we can walk through all your questions, show you all the options. Again, MediConnect Insurance, you can give us a call at 888-818-6334. Go to our website, mediconnectinsurance.com. Thanks a lot, Mark, for joining us. Really helped
Thank
breaking
you.
this down.
Yeah, thank you. It was a pleasure.
We'll see you next time.